Hello everyone, a very warm welcome to the part 4 video of adrenocortical disorders. Here we see the various types of the adrenocortical insufficiency, and in relation to that we also go through the pathogenesis and the clinical features of Waterhouse Friderichsen Syndrome. So let's begin with the introduction. First, we define what actual adrenocortical insufficiency is. Actually, that is the hypofunction of adrenal cortex that results in reduced production of the hormones from the adrenal cortex, and that can be primary or secondary. And if it is primary hypoadrenalism, then that is due to the disease of the adrenal uh, disease. Adrenal cortex is diseased, and if there is a deficiency of ACTH, then that results in secondary hypoadrenalism. So this adrenocortical insufficiency present in three major patterns, that is primary acute adrenocortical insufficiency, that is called as adrenal crisis, and next is primary chronic adrenocortical insufficiency, often called as Addison's disease, and next one is secondary adrenocortical insufficiency. So let's begin with primary acute adrenocortical insufficiency that occurs in variety of clinical setting. As the patient is already suffering from this primary acute adrenocortical insufficiency. So in those patients, if certain things are being exposed, then that results in precipitation of the condition, like if those person get exposed to various stress, then that results in precipitation of acute adrenocortical insufficiency. In acute in adrenal cortical insufficiency, there is destruction of adrenal cortex, that is the adrenal cortex cannot produce various hormones including the cortisol to meet the normal demands. So at early stage of the stress, this cortisol output will be normal, but the adrenal reserve is low. So during the time of stress, when the body is in the demand of higher amount of the cortisol, then at that condition the adrenal gland is uh, unable to produce enough cortisol, and this leads to adrenal crisis. And due to this adrenal crisis, the person may suffer from various hemodynamic decompensation or various hemodynamic conditions as hypotension, shock, disorientation, and impaired consciousness. And in those patients, if exogenous corticosteroid is given, then that also results in precipitation of the condition, because we know exogenous corticosteroids results in feedback inhibition of the ACTH secretion, which often results in destruction or atrophy of the adrenal gland, and that also results in reduced or even low production of the cortisol as well as other hormones for the adrenal cortex. And similarly, massive adrenal hemorrhage can also damage the adrenal cortex, and that also results in adrenocortical insufficiency. And massive adrenal hemorrhage can be seen in uh, newborns who are being exposed to prolonged and difficult delivery. This such types of delivery results in trauma and hypoxia to the newborns, and in those conditions the adrenal blood supply or blood vessels will be more susceptible to the damage. And in patient maintained on anticoagulant therapy, massive adrenal hemorrhage can be seen in such patients. And also and the post-surgical patients who are developing disseminated intravascular coagulation can also can also suffer from the adrenocortical insufficiency, and in this setting that is called as Waterhouse Friderichsen Syndrome. In the figure you can see, you can appreciate that the person who has gone to surgical procedures, they have some various surgical sites. So at those surgical sites, the breeding environment will be good for the various bacteria like Neisseria meningitis, and like Staphylococcus aureus, and the Pseudomonas species, Haemophilus influenza, and so many other. So those bacteria will release endotoxin at those sites, and these endotoxins results in activation of neutrophil and also monocyte activations, and some of the amount of this endotoxin results in the complement activation and dysregulation of the coagulation pathway, and also they will damage the endothelium, resulting in activation of the platelet endothelial exocytosis of a large amount of the bone mineral gland factors, and that results in thrombocytopenia. And this thrombocytopenia is due to this, that platelets and coagulating factors will be used up in making the various microclots within the blood vessels, and that results in disseminated intravascular coagulations, and eventually that will result in multiple organ failure. Similarly, the monocyte which has been activated due to this endotoxin results in the massive release of the cytokines, which again um, lead to the secretion of the inflammatory mediators, which also results in multi-organ failure. And this neutrophil, which has been activated earlier, that results in the production of the proteases, which has various effect on the cellular structures. So all these things contribute to the multi-organ failure, which can be seen in a post-surgical patient who are developing the disseminated intravascular coagulation. So, as a summary, you can see the surgical site became the breeding ground for the Neisseria meningitis, Pseudomonas, and Haemophilus influenzae, and also the various Staphylococcus aureus species, and that results in bacteremia and sepsis. And the delicate blood vessels of adrenal glands becomes more susceptible to the hemorrhage due to the endothelial injury of due to the endotoxins released by those bacteria, and this trigger a massive inflammatory response leading to the disseminated intravascular coagulation, and this results in formation of microclots throughout the body, and this consume all of the clotting factors and platelets, and also the various site becomes more susceptible to the endothelial injury and bleeding. And similarly, these blood vessels which are susceptible to the hemorrhage results in massive bleeding within the adrenal glands, and this results in the destruction of adrenal cortex and prevent the production of the vital hormones like cortisol and aldosterone, and this can be defined as adrenocortical insufficiency in the setting of this Waterhouse Friderichsen syndromes. And these both disseminated intravascular coagulation and adrenocortical insufficiency results in profound shock and multi-organ failure, and often results to death. So these things can be seen in the setting of Waterhouse Friderichsen syndrome, which occurs in post-surgical patients who are developing the disseminated intravascular coagulation. So it is said that we need to maintain hygiene once we are getting injured, or we are going to surgical procedures. After surgery, during surgery, and before the surgery, we need to be very careful so that such things cannot happen to us. Thank you very much.